So objective tests. First of all, we have evoked response audiometry. This includes electrocochleography, ABRs, OAEs, and impedance audiometry. So electrocochleography includes auditory sensitivity to within 20 decibels are measured. An invasive procedure hota hai, and it requires electrodes placement through tympanic membrane. Now for the ABRs, or auditory brainstem responses. This is not a direct hearing test, but it correlates with pure tone threshold. It is identifiable. Waveforms are generally present 10 to 20 decibels above behavioral threshold. And ABRs will provide an ear-specific response, as sound stimulus can be presented to each ear separately by headphones or ear inserts. It is an objective test. It can be done under sedation because that has no effect. Both a screening test and definitive hearing assessment test in children. So that is what ABR is. In a screening test, a response to a click stimulus, which is less than 40 decibels, normalized hearing level or less, agar ho gaya to test will be passed. To find hearing threshold to an infant, ABR tracing is obtained. First add higher sound stimulus and then gradually lower till wave V is just identifiable but repeatable. Now for the OAEs. So transient evoked emissions are generated, which are TEOAEs. They are absent in ears where hearing loss is more than 30 decibels. Distortion product emissions are absent when hearing loss is more than 50 decibels. Now for the impedance audiometry. Normally stapedius muscle reflexively contracts in response to 70 to 100 decibels hearing loss, and this reflex can be recorded. Absence of acoustic reflex. So it could be due to retrocochlear hearing loss, severe profound sensorineural hearing loss, or middle ear disorder. And it is used with behavior audiometry. Acoustic reflexes. Used with behavior audiometry, acoustic reflexes are a useful component to cross-check. No acoustic reflex but normal tympanogram agar ho to plus parental hearing loss concern ho to there could be severe to profound sensorineural hearing loss. Impedance audiometric continuation. Okay, so no acoustic reflex agar ho but abnormal tympanogram ho conductive hearing loss hoga. ABRs and OAEs provide more information. Use of acoustic reflexes in PEDS assessment has declined, and OAs and ABRs have been used in screening programs and hearing evaluation of infants and children. Now for the management. इसके लिए हमें पता होना चाहिए degree and type of hearing loss and associative handicaps like blindness and mental retardation. Hearing loss is prelingual or postlingual, and etiology remains obscure in about half of the cases. So habilitation aims होनी चाहिए कि speech and language and adjustability in society and vocation. Now for the parental guide. So आपने sympathy show करनी है accept the deaf child के लिए, and care and habilitation के लिए बताना है, and periodic evaluation, ear molds replacement, hearing aid replacement, and education vocation के बारे में बताना है. And secondly, hearing aids होते हैं. Most children have small portion of residual hearing which can be exploited, and hearing aids can be prescribed as early as possible. If necessary, binaural aids, which are one for each ear, can be used. Hearing aids help develop lip reading also, and speech and language development की अगर हम बात करें तो communication is a two-way process में receptive and expressive skills होते हैं. Receptive में आपको पता है कि eyes, ears and tactile sensations आती हैं, and expressive में आपको पता है lips and writing involved होती हैं. And हम cochlear implants का भी use कर सकते हैं. In hearing impaired, auditory faculty is poor or totally absent. So proper communication will improve the hearing. It can amplify the इसके लिए हम residual hearing को amplify करेंगे, cochlear implants का use करेंगे. In absence of feasibility of developing auditory faculty, one has to develop visual or tactile means of communication. And then firstly हमारे पास आ जाती है auditory oral communication. It is used by normal person. Best way of communication होती है in deaf, moderate to severe hearing loss, postlingually deaf people में. It provides hearing aid to augment auditory reception. And you have to train the person in speech, reading, and to read lips, face, and hand and body gestures. Expressive skill is encouraged with oral speech. Next we have manual communication, which is in the form of sign language or finger spelling method. एंड इसका डिसएडवांटेज ये है कि एब्स्ट्रैक्ट आइडियाज़ लाइक पेन, हंगर एंड डिजीनेस आर डिफिकल्ट टू एक्सप्रेस एंड टीच इन जनरल पब्लिक who do not understand it. Okay, now we have total communication. All modalities of sensory input like auditory, visual, tactile and kinesthetic are given. Children are taught to develop oral speech, lip reading, sign language. All children with prelingual swear to profound deafness should undergo training in this form of communication. Vibrotactile aids are helpful and in total plus in the total deaf and blind children. They are attached to the child's hand or sternum and vibrations of speech are perceived through tactile sensation. Now for the education of the deaf. So residential and day schools for hearing impaired are present and some children with moderate hearing loss can be put into normal schools and preferred seats उनको class में दे सकते हैं. आजकल आया हुआ है radio hearing aids. So this is a revolutionized education of the deaf. In this, a microphone and transmitter are worn by the teacher and receiver and amplifier are worn by the child and then सिर्फ hearing होगी उससे and कोई भी background noise नहीं होगी. Okay, now for the guidance, vocational guidance. So you have to commensurate with their ability and several vocations are available, usually employed on the basis of skill development. So they can also learn from videos. So receptive skills and expressive skills. Expressive में oral, sign language, finger spelling, written communication, letters and electronic media आ जाता है. And receptive में हमारे पास visual, auditory and tactile आ जाता है.